Hello, so today I'm here to talk about EMDR. You might have heard about this, seen about it. It seems to be everywhere at the moment. It's eye movement desensitization reprocessing, and basically you work with a registered therapist, and it is really important that you find a very experienced therapist. It helps you recover and process trapped emotions and trauma from past experiences. So for example, CBT, cognitive behavior therapy, can give you tools to manage all your anxieties and different things that you might go through, whereas EMDR actually goes in and your brain is so clever, it repairs the trauma, so you don't have to keep experiencing all this panic and anxiety and depression. You can basically have this done, and then for that particular trauma it's done. It's not something where it's continually causing anxiety, stomach problems, headaches, and you're trying to find ways of managing it when that trauma triggers you and you don't know when. So this is a completely different experience, a completely different set of tools. As I said, I am not a doctor, I'm not a therapist, I'm not anything medical, so you have to go to your doctor, discuss everything with your chosen therapist and find out whether it's right for you. I'm talking personally from experience and just about what I've heard and seen and experienced with it. There are some people apparently that can't have EMDR, maybe those with bipolar or personality and mood disorders, but again, that might not be completely the case for you, so it's always worth checking out with your doctor. So it works with eye movement. It's not hypnosis, you're totally in control. It's definitely not hypnosis. It's not brainwashing to make you happy or forget your trauma. It basically works so the therapist will move her hand out side to side and your eyes will follow her fingers. So you'll sit down together and work out some goals of what you'd like to fix that have been bothering you from your past traumas. It's really good for anxiety, depression, PTSD, anybody going through any of these kinds of things, panic. And basically you'll sit down, look at the goals that you want to address, and then your therapist will get you to, she'll talk about one of those goals that you want to address, and she'll get you to start following her finger. I basically, because my therapist explained you can't sit there all day doing this, so I actually had two little buzzers, one in each hand, and the left buzzer works on the right side of the brain and the right buzzer works on the left side of the brain, so it's bilateral movement. So as I said, your brain, what happens is then your brain, after you've had the therapy, your brain continues to make sense of the experience after the session, and especially when you're sleeping, so your dreams can be a bit strange as well. But it is a short-term fix. It's not years and years in therapy, so the cost will be lower for you than being in therapy. And sometimes 10-20 years in therapy doesn't uncover things the way this does. So you have to be stable first. If you're using drugs or you have an alcohol issue, then it's not going to be right for you either. So you have to be in that position where you can be fairly stable and work with this. So basically my eyes were shut when we did the holding of the two buzzers. And so for example, let's just say you've had a bad car accident and it's really troubling you, you get triggered on some days and you don't know why, and you've got the CBT tools to help you manage the anxiety and the panic, that you can say to your therapist, okay, I want to go and look at this car accident that happened in such a year. So you can close your eyes with the buzzers or watch her fingers and she'll talk through that sentence with you, and your brain will take you into that trauma. And you can experience grief, you can cry, you can experience physical symptoms like your stomach could be really tight or breathing shallow. I used to get a headache above one of my eyes, and your brain will go in and will replay some memories to you, which you'll then repeat back to your therapist. So it's about 50 seconds, it's really quick, and she'll write down, and then you'll hold the buzzers and you'll go back in again, and she'll perhaps talk about another sentence from what you've said, and you'll just do it till you've cleared it. And you know, some people get relief straight away after weeks of this. Sometimes it can take a few months. What I will say is it does make you feel pretty rubbish after. So you can imagine your trauma of the car accident every day is here. It's not right up against you, but it's there and it's bothersome. The EMDR will bring it right up close to you. And then as the days go past after you've had the EMDR, and your brain processes it, and it can do that through sleep as well, so your dreams can be strange, it moves the trauma out to the side and it just no longer bothers you. It's like that connection between you and that car accident is gone. So it's like a load of files on the floor that your brain has never made sense of. You've had the car accident, thrown them all on the floor, and you're not dealing with it, and your brain just puts it all back in little folders. So it's amazing. They don't know how it works exactly, but the NHS are offering it. It's being done in prisons, hospitals. So it is an amazing therapy. As I said, it's a lower cost as it's a shorter time frame than sitting in therapy for years. And you can have 8 to 10 goals, or however many things are bothering you, that you can talk through with your therapist. So basically, it doesn't unlock memories that you're not ready for. There's not going to be something suppressed in your mind, that something that terrible that's happened that you can't remember. It doesn't unlock memories. It's just unlocking the things that you're talking about. So there's not going to be any great there's not going to be a great shock for you there. It's going to be stuff that you've agreed to and can talk about. So basically it was discovered by accident in 1989. A lady called Francine Shapiro was walking through a park in New York. She had suffered trauma, and she noticed that when she followed the skylines and the different shapes in the park, that her trauma receded. And she tried it out with friends and kept trying it and realized she was onto something. A lot of research was done over many years to look into how this would work, and now it is the great tool that it is today. And you know, read all about it. EMDR is absolutely amazing, especially if you just cannot get on top of that anxiety or depression. And you may find that once you've had it done, you can reduce your antidepressants if you're on them. Yeah, so what the therapist does, so they'll tell you about it, you can go away and research it. Then they'll sit and talk to you another week, and you'll have a couple of counselling sessions possibly about the things that are troubling you, talk about your goals. They'll go through a safe space that they can take you to at the end of each session to calm you down and put you back into that positive mindset. And you might use a few anchor points of people you trust, and the therapist will prepare you well. As I said, please make sure you do. I have seen stuff on YouTube and TikTok where do it yourself EMDR. It's not something I ever want to do. It's something that somebody qualified would need to do with you. As I said, my lady is amazing in Southampton, near Southampton. So just make sure you've got somebody that has a lot of experience, has trained well in it. And yeah, so let me know if you've had it. Subscribe to my channel if you haven't already. Just let me know your experiences, or if you're thinking about it, any questions you've got at all, any worries, concerns. I was really nervous before I had it. I just thought there was going to be loads of stuff that I hadn't thought about, but actually it was absolutely fine. And most people do say they feel pretty rubbish for a few days, a week after, and then it just dissipates and goes. So yeah, if you've got any questions at all, let me know. Hit the bell, so if I release any more, or when I release some more mental health videos, then you'll be aware of it. But have a great evening, and I'll be back soon. Bye.